food adulteration? It's very simple. Food adulteration. Food adulteration is when you add or remove substances to a food item that is not part of the food item. So that's when you adulterate it. It can be intentional, it can be incidental, it can be metallic adulteration. So we have different types of adulteration. So for intentional adulteration is what mostly everybody has been talking about, adding for economic gain or to ensure that we want to get as much as possible from the food product quickly. Because, in business, time is money. So a lot of people will try as much as possible to ensure that they do different crafts, bring different ideas into the food to ensure that people can buy it, people will still buy it. So those are the kinds of things that we look at when we're talking about intentional adulteration. But when it comes to incidental adulteration, incidental adulteration refers to the accidental food adulteration. So sometimes you add things accidentally. You may not know. It may be based on your ignorance, negligence, lack of food hygiene training, lack of food safety training, understanding of food safety management system. So it may not be intentional, but there are some that are intentional. But we'll go through some of these things. Then, of course, you can have metallic adulteration where metallic substances are intentionally or accidentally added. So they include arsenic from pesticides, lead from water, mercury from effluents, and all that. Again, this may not be purposely added, but they are already included in the food items because of the lack of training, lack of understanding of the impact of it. It's a serious concern. Food adulteration is a serious concern everywhere in the world. It's not only Nigeria. Everywhere in the world, people try as much as possible to adulterate food items because of economic gains, also for different reasons. It may interest you to know that olive oil is one of the most adulterated foods in the world. Although we don't use it as much in Nigeria, aside from maybe we are doing religious purposes. But usually it's widely adulterated. Honey is also adulterated, widely adulterated. So it's not only in Nigeria. Even if you go to the European countries, you ask for honey, they'll tell you it's pure honey. But these are processed, so many things are added, but they'll tell you it is pure honey. So labeling also is part of what we talk about when we talk about adulteration. The labeling aspect as well. When you promise what is not in the product, you're adulterating it as well. So then, the next slide. So understanding palm oil adulteration. So because we are talking about palm oil now, so I want to narrow a little bit into palm oil. Most of the cooking oil in Nigeria, all our cooking oil, our vegetable oil and all, a lot of them are derived from palm oil. We'll not go into the food science aspect of it because that's not what we are learning today. But these are usually adulterated with harmful substance like dye, color, to change the look, appearance. So sometimes they will tell you this thing looks beautiful because if they add the red color into palm oil, you look at it and say, this palm oil is supposed to be red. So the palm oil that is not as red as it's supposed to be, if you don't add, they say, this one is not palm oil. So because you want to gain more customers or because you want to sell more, you add some of this dye. And this will tell you some of the health effects of some of these things. Of course, lard. Thank you, sir. Lard is animal fat, usually from pork, is also added into palm oil. So you may also, and it's not only in Nigeria, like I said. These are done even in our other West African countries, Sierra Leone, Liberia, and co. Yeah. So then, of course, you also have transformer oil. Let me just use that like that. But you may want to narrow it down to like paraffin oil. They add it to this oil because it's paraffin oil. The chemical nature of it is that it's when you boil it, the boiling point of that is so high, it's about over 500 degrees Celsius. So before it burns off, it takes a long time. So when you add a little bit of it into palm oil or into your vegetable oil that you use to fry akara and all that, it lasts longer. But it is very, 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 I don't know how many varies I would say, very dangerous to your health. It is very, very, very dangerous to the health. So no matter how small you say, let me just add small, let me just add just one, maybe 1 liter or 1 centiliter or whatever you say you want to add, just please don't. It is dangerous to the health. So, of course, it poses, like I said, people do this for desire to increase profit, their profit margin. Of course, it is very harmful to the health. So please and please, it's not something that we need in our diet. A lot of people will look at and add those, like I said, pork fats. Even you say, and there are some religions in this country that do not eat pork, but they will not know that the oil that they are using has been adulterated with this pork fat. It's dangerous. So please, there are so many, there are research that have been conducted in Nigeria that have found out such. So please and please let us ensure that our food is what we say it is. Now, I want to zero down to the health risk associated with these adulterated foods. So what do we eat? How do we, what are the effects? I'll bring up some of the effects to us. There are some documented effects. It has been linked to, adulteration has been linked to diarrhea, abdominal pain, nausea, vomiting, visual disturbance. I remember there was a time, so there are some other like brain damage, stomach disorder. So in 2008, melanin was added into baby formula that kills 6 children, and over 300,000 were sick in China just because melanin was added to the milk. It's part of adulteration. These are health effects. People die. People end up losing vital organs because of adulteration. There is significant health risk attached to this. Let us understand that, please. I don't know how to say it more, but it is vital that we understand that these things can kill people. So I'm just trying to show you. In 2013, methanol poisoning affected 69 patients, 8 of whom died in Iran. That's other countries. Now, methanol, usually when you do brewing, you can have methanol, okay? Fermentation can lead to methanol production. Methanol is bad for the health. There was I think in Ondo and I think in Port Harcourt some years back, we had cases of methanol poisoning as well. They said they didn't know what was causing it. Especially in Ondo State, people were going blind. And they didn't know why. Blindness. Because people were taking alcohol. Thinking it is ethanol that is the alcohol inside, not knowing that it is methanol. And people were going blind. Same thing happened in Port Harcourt. These are part of food adulteration. Some may not be intentional, but because they don't understand the rudiments of the production of alcohol, alcoholic beverage, okay, they make mistakes and end up killing people or making them blind. These are real people, real Nigerians like you and I. So we need to talk to ourselves. Like the acting executive vice chairman has said, we need to tell ourselves the truth. We are killing ourselves. We are the ones killing ourselves. It is not the government. Because the government is not adding methanol into our food. We are the ones doing it by ourselves. Okay? So let us tell ourselves the truth. In 2021, this one is very recent and it touched me actually because I was on the scene, I was on the ground in Kano, and it touched me personally. In fact, this case, over 427 people were hospitalized. 3 people died because hydroxyamine sulfate was being sold on the streets to people in Kano. Hydroxyamine is used in mining, where you mine for all this limestone and all that. They use it for blasting. And because it looked like dansami, I don't know those that know, those that speak Hausa here, dansami, because it's like citric acid. So they add it to the food like a food additive. Okay? That's the normal thing that is being done in the northern part of the country. So, but because it looked like it, somebody brought it to the market, dropped sacks of it, and they didn't know what it was because there was no label on the sack. The label had cleaned off. So they thought it was it because it looks like it. You say white substance, everybody is white substance. Salt, sugar, they look alike now. They are all white substance. But no testing, nothing whatsoever was done. And because it was cheap, it was sold at a fraction, I think about 1/10 of the real price. They started buying it and selling it. In fact, in a house, a man died. He was one of the people that died. You know, as a big man, they have this juice in nylon, all this powder juice. You mix it with water, okay, to drink. So because, of course, he's a big man in the house, so he decided that you add more of this dansami, not knowing it's hydroxyamine sulfate. He lost his life, unfortunately. The family was hospitalized. You see a child, liver failure, his whole body yellow. Then those that actually even survived the hospital that they discharged, after a week or so, they came back to the hospital. You know what they came back for? Renal failure. A lot of them lost their kidney. Because, and we saw the two men. Two men. Just because of 2 men, a lot of this happened. Food adulteration is bad. Leave the food the way it is. If the color of your palm oil is orange, not as red, sell it as orange. Don't add color. Don't add dye. Sudan dye. I've forgotten the name now. Yeah, Sudan red dye. You add it to it to make it red. It's poisonous. It's poisonous. So these people added it to all their locally, aside from those juice, they added it to all this kunu, soya beans, awara, and co. They mixed it together. So they were eating. Different people, men, women. So it's not all about me, I don't eat kunu, so I'm okay. No. They added it to different types or categories of food. Okay? So please, and a lot of people lost their lives. This was just a conservative number because these were the ones that presented at the beginning. Those that came back we could not identify their numbers, because even the hospitals, if you know Nasarawa Hospital in Kano, it was overwhelmed. They didn't have any space again. It's terrible. So please, let us be aware of what we are doing, please. Then these are other common adulterants. Of course, in milk, some people add water. Some of the water you are adding to the milk, what does it? How does it? Where do you get it from? You know, some of this water can have parasites, including cause digestive disorders and all that. Of course, sugar. There are so many. Some add chalk powder to sugar, salt. They add white powder, stones. You know, so chili powder. That's in Yoruba, tagungun. Red pepper, grounded pepper. Some add color, like we are talking about red color. Okay, just to make it look very red. Please don't do it. If it's not as red as, just set it that way. Please. Please. Adding things to it causes, some may not die. Because some people, you will tell them, they'll say, I've been eating it, I've not died. But the truth of the matter is that your body is different from the next person's body. And we cannot quantify what that thing would happen. What you may not be able to correlate it when your body, after 10 years, maybe that person loses his one or two organs or has cancer after 10 years. We may not be able to correlate it to that practice. Okay? But some people have immediate effects. Even if it's not immediate effect, long-term effect is also an effect. So please let us be aware of that. Butter, honey, like I said, they add sugar to honey, different things. Of course, vegetables, green vegetables, they add coloring. This can also cause cancer. Vegetable oils, they had, like we mentioned, vegetable oil, palm oil. Then rice, wheat. I think our acting EVC, he mentioned the issue of tiger nuts, adding stones. This can cause so many things. Stomach upset, even cause so many things. It can even affect your teeth, even if it doesn't kill you. Of course, fruits. I heard there are some people from the fruit sellers or something association here or something related to fruits. Please tell your people the calcium carbide used in ripening fruits is bad. It's bad. You can see it causes respiratory issues. It causes cancer. It is very bad. What are in those calcium carbide? You have heavy metals in calcium carbide. Heavy metals. And these heavy metals, our body cannot process them. And because our body cannot process them, they become a nuisance to us. And by being a nuisance, they send us to the hospital. Those are the kinds of things we see every now and then. So please, you can delay even the harvesting of the fruits, or you can wait till the fruits ripen by themselves, natural ripening. Please. So there are so many. Some people add pesticides to leaves and their vegetables. They spray pesticides. What do they call that pesticide again? That common one, sniper. They will spray it. Vegetables, beans, and all that. They spray all these things. You are adulterating that food. So please, I beg you, don't add pesticides without the supervision of a professional. Don't apply pesticide. Even on the farm, I know there are farmers here. Seek the guidance of professionals in the application of pesticides. It is very, very important. You can't add pesticide today and harvest tomorrow. It is wrong. When you harvest, that food is meant to be consumed. The pesticide has not degraded yet. So it is important that the pesticide degrade naturally before it's being sold and marketed for consumption. So, and different pesticides has different half-life. So they degrade at their own different rates. So if you add this pesticide and you know that this one degrades within 2 days, it doesn't mean that when you add this other one, it will degrade in 2 days. It may take 2 weeks. So please, and even these pesticides, they have their instruction manual. Sometimes if you see the leaflet, if you roll it from bottom, it can be as tall as this, as me. You will see the paper in different languages. Okay, English, French, German, and all that language. You know, they have it. So please, read it carefully. Use professionals to apply pesticides. It is very important. These are the adulterants that can affect people when they consume food. And you can see when people take pesticide, it causes neurological problems. Okay, sometimes you look at, what's wrong with this child? This child is not growing properly. It's not because the mother did not give birth to that child very well, or because men, I'm a man, sorry to say, sometimes we blame all our problems on the children, about the children on the wife, you know. So it's not about the wife. Sometimes it's some things we eat that causes some of these neurological problems. So please, let's beware of this. So prevention, when we look at prevention strategies, preventing food adulteration, there are so many ways you can prevent them. I've only highlighted about 5 here. Yes, thank you. I've only highlighted about 5. Policy and regulation is one of them. So it's important that the government do their bit. The government do their bit to set out laws, regulations. The regulations and standards for food quality. We have as SON is here. We have our standards for a lot of our food items. There are standards for them, and there are also penalties for them if you go against those standards. Okay, there are penalties, but because the country is big, we have over 200 million people. At the national level, we have those that will regulate. At the subnational level, they have those that they also regulate. Okay, the national level may not be able to reach everywhere. You can agree with me. So we also need the subnational level as well to do same. Thank you. So it's important we do that. Public awareness and consumer empowerment is very important. I'm happy that FCPC have brought this awareness. This is part of what we are talking about, public awareness, and of course we empower our consumers to identify what we need. Then technology and testing. Of course, we need to be able to improve our technology. I'll come to that in the next slide. Technology is very important. Testing of our food products on the spot is also important. If you can test them on the spot to know whether they have adulterants or not, it's important as well. So we need to improve technology. So those are the ways to prevent adulteration. Inspection, monitoring, enforcement. Enforcement is critical, and not only at national, at subnational level is very critical. Then capacity building. We need to build capacity. What we are doing is also building capacity here. We're raising awareness, but we're also building capacity. We also have to set out time to train people to do that as well. Then for palm oil adulteration specifically, we need to purchase from reputable sources. It's important that NAFDAC will tell you when they will say our products, anyone that has NAFDAC, NAFDAC number, okay, you can purchase those ones. Go to reputable places to purchase. Don't purchase on the roadside. We've had situations where people will come and bring all sorts of food items to the market on the roadside. Same thing happened, that Kano story I was talking about, same thing happened. It was on the roadside. Till today, they don't know the person that brought that item. But he just sold it and said that's the item and that's the price. Okay? So it's important to purchase from reputable sources that you can trace back. So don't say somebody brought mango from his house because he has mango tree in his backyard and is selling to you, is he a reputable source? Before you come and sell that mango to me, because I'm coming to your market to come and buy mango from you, I trust that you bought that mango from a reputable source. So if you are selling that mango to me, let me be able to trace, you must be able to trace back to the person that sold you that mango and ensure that that person also has good agricultural practice and all that. Strengthening foodborne surveillance, and we've done a lot on that. Ensure that we survey foodborne disease outbreak, like I said, the one in Kano as example, and ensure that we prevent them as much as possible or reduce them. Then enforcement of labeling requirements. It's important that we enforce our labeling requirements. We have labeling laws, regulations in the country, and we need to improve the enforcement. Like I said, enforcement is critical, not only having the laws, but the enforcement. Then, using adulteration detection techniques. This is also very, very important. There are rapid techniques that have been identified to detect this palm oil adulteration. And then I just brought about 2 of them. Attenuated total reflection mean. So these are, and then of course, NIR, portable near infrared spectroscopy. This can also be used to test the authenticity of palm oil in the market. There are papers about that. I can share some of those research that have been done to show that this can work. I've been given less than 5 minutes, so I'm pushing ahead as fast as possible. So what is our duty as people, as a government? What are we doing? So of course, I work with Federal Ministry of Health. So like we work with stakeholders such as the FCCPC, NAFDAC, SON, you're all here. We try as much as possible to address the availability of safe and quality food for all of us. We also look at, like I just shared, the Honorable Coordinating Minister of Health and Social Welfare just launched the updated National Policy on Food Safety and Quality and its implementation plan just last week as part of the celebration of World Food Safety Day. So in the documents, he also ensured that we review, we have the guidelines for display, sale, transport, and marketing of food for traditional markets, online markets, because a lot of our foods now are online now. It's a very growing market. So we need to have guidelines for some of those things. So we don't just, a lot of anyhowness are affecting our food safety in this country. People just do things anyhow. It's very vital that we set guidelines and for all those. Then we also have the Foodborne Disease Surveillance and Response Guideline. This has also set the ball rolling for proper surveillance and getting data on those that are sick, and we need to also link them up to the food products that cause that, so that we can take those food products off the market shelf once we identify the correlation between the sickness in the human and the food itself. Of course, we need to build, like I said, build capacity of sub-national officers. We are doing that regularly. We've gone to so many states, about 24 states, to ensure that they know about food safety practices and the food safety management system. So, of course, we're also developing campaign materials for food operators and consumers. So it's important that, of course, we join forces with all our partners as well, the FCCPC and other partners, to develop such campaign materials. So finally, this is my last slide. So thank you. This is my last slide. So it's just a call to action to encourage us, consumers and businesses, to report any suspected cases of food fraud, food adulteration. Okay, so please be your brother's keeper. It's important that we inform on those that are doing these sharp practices. Let FCPC is here, NAVDAC is here, SOM is here. You can report to anybody. We all work together. Federal Ministry of Health, you can report to all of us. I think it was projected the other time during the documentary, the numbers that you can call or the social media handles you can report to. Please, if you see your neighbor in the market that is doing some of these things, report it. Report it. It's important. Report it. Then strengthen inspection and surveillance. This is talking to us as government stakeholders. Of course, we need to strengthen our inspection and enforcement. And of course, educate and raise awareness of the public about the dangers of food adulteration. So this is one of those things we're already doing now, but we need to do more. Beyond this room, we need to go to the streets as well. Let's raise the awareness. The TV, the media people are here. Let us raise the awareness that food adulteration has health implications. Thank you very much.